Our next disease is cat scratch disease, also known as Bartonella Hensley. That's the actual organism. It should be suspected in more chronic lymphadenitis. We have discussed cervical lymphadenitis, for example, in the ENT chapter. We have mentioned on many occasions that when we talk about lymphadenitis in children, we always think of infections first, malignancy second. This is one that lasts a little bit longer and is still an infectious disease. So you should suspect it in a lymphadenitis that lasts more than 3 weeks. It is transmitted by cats, but kittens seem to transmit it more effectively than cats do. It's felt to be with the fleas. Be that as it may, just remember it's transmitted by cats. Kittens do better. And the incubation period is a wide range from 3 to 30 days. The cat scratches the patient, and you will get usually a linear rash. Some papules occur in a linear fashion where the cat scratched the patient. Then you'll start having regional lymphadenitis. So what that means is if the patient was scratched in the arm, look for regional lymphadenitis. So look for enlarged lymph nodes, for example, in the axillary region. If the patient was scratched in the face, you can look for lymphadenopathies in the neck. If the patient was scratched, for example, in the legs, you can look for inguinal lymphadenopathies. So they go to a larger regional lymph node area is what you're going to be looking for. They may have some fever and other constitutional symptoms, and very rarely do they have like abdominal pain and weight loss. They can also sometimes have what's known as paranoid ocular glandular syndrome. This is a unilateral conjunctivitis, so here's another bacterial cause of conjunctivitis. But they also have preauricular lymphadenopathy, cervical lymphadenopathy, and usually this occurs after they rub their eye. They might have been scratched in the face, on the hand, and then they rub their eye, and that can lead to a paranoid ocular glandular syndrome. Here the arrow is pointing at a small papule on the hand, on the finger, and that might be where the cat scratched the patient. It might be a single solitary lesion, or you might have several of them along the line of the scratch. Usually this is the diagnosis is made clinically. You have a history of cat scratch, you have maybe a visible scratch mark, and you have the lymph nodes. But you can also do further testing. The best test is actually to do PCR of the lesion, so of the tissue. So you have to get a tissue sample and send it for PCR. You can also do what's called Wharton starry silver stains, and you actually see the organism on, again, a tissue sample. You do have blood tests that can be sent off, but if they push you to look for the best test, pick PCR. Treatment of cat scratch disease is not necessarily controversial, but you can go one of two ways. Many patients will get better on their own. Other patients, if they're not getting better or if the lymph nodes are actually painful, will respond to treatment with antibiotics. Certainly you can try the macrolide antibiotics, and those will help.